The next presenter we have is the Veterans Affairs, and that will be Mr. Jeff Springer. He's the Outreach Program Coordinator for the Columbus VA, and he believes that all veterans should enroll in VA services. So I'll let him talk to you about all of that. He is an Army veteran with 20 years of administrative and management experience, whose goal is to enhance the program while staying in scope with the agency missions. He's been with VA for 7 years and comes to us from our next door neighbor at the VA, which is right adjacent to DSCC. So welcome, Jeff.
Yes, I'm definitely glad to be here. Again, my name is Jeffrey Springer. I'm the Outreach Program Coordinator for VA Central Ohio Healthcare. I just want to go over just the brief learning objectives that I have. We're going to do a brief overview of services and highlight the service we have, whole health, and go over eligibility and basic requirements on how to apply. The Department of Veteran Affairs basically has 3 pillars. Is VA Benefits Administration, and that is pretty much anything regarding your benefits. VHA is where I'm at, and we provide the actual healthcare solutions. Then you have National Cemetery Administration to provide burial benefits and services. The VA services are not limited to what's listed. Mental health, we provide that. We provide long-term care and programs. We provide pharmacy, chaplain support, caregiver support, housing support, women's health, geriatric, preventive care, primary care, specialty care, substance abuse and weight loss management, and also some veterans may qualify for dental care. Okay, what is whole health? Whole health is an approach to healthcare that equips and empowers veterans to take charge of their health and well-being and live their lives to the fullest. The Department of Veteran Affairs fiscal year 2018 to 2024 strategic plan briefly states, whole health, VA will provide personalized, proactive, patient-driven healthcare to empower, equip, and encourage veterans to take charge of their health and well-being and to adapt healthy living practices that deter or defer preventable health conditions. Whole health is personalized, it's proactive, it's patient-driven, patient-centered care, and it moves from what's the matter with you to what matters to you. And it's just a focus on the whole person, including one's values, ideals, and not just their disease or condition. VA has a number of different services, not only your typical hospital services. Being eligible and being enrolled is important, and it starts with enrollment. Basic eligibility requirements I have here listed. If you're enlisted after September 7th, 1980, or entering active duty after October 16, 1981, you must have served 24 consecutive months or the full period for which you were called to active duty. This minimum duty requirement may not apply if any of the following is true. If you were discharged for a disability that was caused or made worse by your active duty, or were discharged for a hardship or early out, or served prior to September 7th, 1980. Now, if you're current or former member of the Reserves or National Guard, you must have been called to active duty by a federal order and completed the full period for which you were called or ordered to active duty. Now, with all this said, as stated before, I think all veterans should enroll. And I'm gonna tell you why, or at least try to enroll. I encourage every veteran to enroll. We never know how these legislations may change. So I want all my veterans that are eligible and even the ones that aren't to at least get in the system. We never know how things may change. All these dates and requirements may change. Who knows? So it's better to be at least implemented, whether you're denied or not. So maybe, hopefully, things may change and you may go back if you're not eligible. To apply is fairly simple. You fill out a form called the 1010 EZ. We actually have a number where you can call to get assistance if you're having trouble. There is an online link. I actually have it in my references where you can just fill it out online. And there's also it's also in Spanish. We have it in Spanish to fill out also online. You may mail it to the HEC Center. That's also within that link. That is in Atlanta, and you may apply in person at your local VA center or clinic. Also, I can't deny any veteran from mailing it to the clinic. If it gets mailed to the VA Medical Center or the clinic, we are obligated to open it, and you will get a call, and we will try to get you enrolled. And that's briefly what I have. Here's some of my information. Provided the enrollment eligibility number. I can be reached there also, but our staff is just great. They can answer any questions or direct you anywhere you need to go. And I like to reiterate, we've talked about the VA ID card. You will talk to them about that as well. It's actually located right behind their desk to get that VA ID card that may allow you to get on base and also proof of your service. So yeah, that's all I have. Any additional questions and questions that are more personal to you, I please encourage you to call us directly to get those answered.
So Jeffrey, we have two questions for you at this point. The first one is, what if you are a reserve or guard member and are rated at 0%? That should qualify, correct?
If you're rated, if you have any disability rating, even if it's rated at 0, as long as you either showed active duty or were injured on those orders, you are eligible to get VA care.
Okay, so just to make sure for those people that are listening, the rating is different than the disability level, correct?
Correct.
So you would still be eligible to register with Veterans Affairs, correct?
Yes, you're eligible. You are eligible to register. There are some tricky situations dealing with some National Guard and reserves as far as their orders and things like that. And we will work with you to at least find those answers for you to try to see if we can, whether it's retrieving paperwork that wasn't retrieved, we will help you get there.
Perfect. So I have another question for you, Jeffrey, which is if you have a service connection disability, but we're told that you make too much to be enrolled at the VA, except for that one disability, can you try again? This particular person has insurance, but would like to be seen at the VA for everything, not just one thing.
If you have a service-connected disability and VBA has gave you your rating, you can go to the VA hospital. If someone is so different, you need to contact us.
So please, just to remind everyone, these slides and the presentation will be available on the DSCC MWR webpage. You can go back and consult with those. And if you have specific personal questions that you want to get an opinion from Jeffrey on, and he can assist you with guiding you to a particular point of entry in VA, I would recommend that you give him a call. Okay, that, as I said, that information will be available on the webpage and in the presentations. So I see one more question that was posted, a local My Health Vet POC that they can reach out to. Jeffrey, would the recommendation be that this particular person reach out to you and you can give them some guidance?
Yes, yes, definitely. They can surely reach out to me.
Okay. Perfect. Then again, thank you so very much for joining us, and a wealth of information. We appreciate so much your time.
Thank you.